Humanta First Uganda, under its program Global Health, held a free medical camp at Ahmadiyya Muslim Hospital in Mbale district, about 262 kilometers from Kampala, the capital city of Uganda. This free medical camp served over 1,500 people of different walks of life from Mbale district and 7 neighboring districts including Bukedeya, Bududa, Sironko, Soroti, Budeka, and Chibuku. The camp lasted for 5 days, serving different people with different medical complications, and a number of medical services were offered ranging from antenatal, dental, ultrasonic scan, free open pharmacy, medical consultancy, laboratory, counseling and guidance, homeopathy, and many more others. The chairman Humanta First Uganda, Mr. Mobiru Haruna, together with the Director Operations Humanta First Uganda, Mr. Asmani Mugabe, performed an inspection of the different departments put up to provide the best of services to the vulnerable. Speaking to the chairman, Humanta First Uganda, Mr. Mobiru Haruna, this is what he had to say about the medical camp.
This has been a 5-day medical camp program. We are in the eastern part of the country, that is Mbale, and we are at the Ahmadiyya Muslim Hospital. As you are aware, 2020 has been mad with COVID-19. This pandemic has affected the entire globe, economically, socially, but despite the challenges, as far as the pandemic is concerned, Humanta First Uganda, Humanta First International, Humanta First UK has always been at the forefront of providing services to the vulnerables.
The Director Global Health, Dr. Musa Sechikubo, was extremely humbled by the services rendered to the vulnerable people that benefited from the medical camp, and this is how he expressed his gratitude to the volunteers and founders of Humanta First.
We are also very grateful to the administrators in the various districts and the regions that we worked in that offered us their support, the health workers who volunteered to look after the patients, other youth organizations that came to our rescue and made sure that the medical camp was conducted in a smooth way. The local government administrations and the departments of health in those local governments that also supported us in one way or another. We are also grateful that when we called out to those who needed help over the radio stations and the TV stations in the Eastern region, they wholeheartedly came, and we tried our level best to deliver the best that we had up our sleeves. We are indeed grateful to the volunteers, to the patients who came, to those who supported this process throughout, and we are also hopeful that in future we'll have an opportunity to come back again and offer the same service or even much more than what we offered this time around.
In an explicit interview with some of the volunteers in this medical camp, this is what they had to say.
I'm so happy to be here for this wonderful medical camp. I got to know about it from a close friend and a colleague at work. Abudu, who I found out recently as well, is the director, Gift of Sight at Humanity First. We had a similar camp like this about a week ago in Budiope, and the experience was very beautiful.
My name is Abdu Chwanuka, a medical laboratory scientific officer, and I happen to be the program lead of this program under Global Health, under the Humanity First Uganda. Global Health caters a number of programs, and today we are having a medical camp, call it a medical clinic, here in Mbale at our very hospital, that's Ahmadiyya Muslim Hospital, Mbale. We started this program with the aim of reaching out to those most needy yet neglected in this society. The majority of people who cannot access very good medical services. And we started this program on Monday, and it's running through up to Friday for 5 days. And we are having the doors open for the very first time. We are having an open clinic where we are serving people in about 6 departments. We have free consultation with medical doctors.
The people of Mbale and the neighboring districts that benefited from this free medical camp greatly appreciated and were humbled by the humanitarian heart exhibited by Humanity First Uganda and its volunteers.
Meno gase ndifwe na mataka nezera ano kina lwe ifuneko bujanjabi bula mbose bunaka buli bulaida atendi nakindi kwasimire basabu befe bano kukweza ano era ndi kukirosera bakujanjabe kuvenga muni usi kwaba ko balayi
enjanjaba ino lwe kuba balwale kusiliyo sikwaweleyo tawe kusili bakali kale oba bandi kongeletsi na kubalebe basi kunyalisa kujanjabi wafwe sitana lwe kubanga ife basakhulu bafura bukali basili inyuma isi bamanyile injanjaba ino nga yakwawo ta.
Nasser Ahmad Sonko reporting for MTA International, Africa, Uganda.